আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু। বিসমিল্লাহির রহমানির রহিম। সবাইকে স্বাগত জানাচ্ছি বাংলাদেশ হোমিওপ্যাথিক পরিষদের অনলাইন ভিত্তিক উচ্চতর প্রশিক্ষণ ক্লাসে। প্রিয় উপস্থিতি, আপনারা জানেন আমরা নিয়মিতভাবেই বাংলাদেশ হোমিওপ্যাথিক পরিষদের পক্ষ থেকে প্রতি বুধবার আমাদের এই অনলাইন ভিত্তিক উচ্চতর প্রশিক্ষণ ক্লাসটি পরিচালনা করছি। আমরা আমাদের রমজানের আগে আলোচনা করছিলাম রোগীলিপি প্রণয়ন, ওষুধ নির্বাচন এবং দ্বিতীয় ব্যবস্থাপত্র এই বিষয়ের উপরে। আলোচনার শেষ পর্বের আলোচনা আজকে করবেন নিয়মিতভাবে পূর্বের আলোচনাগুলো করেছেন আমাদের প্রিয় শিক্ষক, বাংলাদেশ হোমিওপ্যাথিক পরিষদের সম্মানিত সভাপতি ডাক্তার শেখ ফারুক ইলাহি স্যার। আমি স্যারকে পূর্বের আলোচনা সূত্র ধরে আলোচনায় আজকে শেষ পর্বের আলোচনা উপস্থাপনের জন্য বিনীত অনুরোধ জানাচ্ছি। প্লিজ কন্টিনিউ ইউর প্রেজেন্টেশন স্যার। আলোচনা
ডাক্তার শেখ আনোয়ার পাটোয়ারি। Dear viewers, Assalamu alaikum wa rahmatullahi wa barakatuhu. Good evening, adab, and Eid Mubarak. Actually, it was English program. That's why it is the last phase of our previous lecture. That's why I am delivering in English. So, in last lecture, we finished Kant's 12 observation, but Vitulka's 22 observations we could not finish that day. That's why I'll recapitulate little bit Kant's 12 observation, then I'll switch to Vitulka's 22 observations. I think if you understand Kant's 12 observation, that this is very easy to understand Vidulka's 22 observations, because Vidulkas based his observations on the observations made by Kant. So we discussed about the definition of second prescription, because we find that many of our colleagues, they cannot define truly what is second prescription. That's why I'm telling second prescription is the prescription made in the follow-up visit after the remedy of the first prescription has acted on the patient. You see, we have emphasized on acted on the patient. Your first prescription medicine must have acted on the patient. Then only question of second prescription comes. But if your first prescription remedy is a futile one, is a failed one, then there is no question of second prescription. You will make first prescription again only. So this is very important. So it is said that there are some people who makes first prescription throughout his life. They cannot make second prescription because the first becomes wrong. So let us see. You may observe what we will observe after a patient has first prescription of the symptoms. What symptoms he came with disappeared. That he had cough, now he has no cough. Or it may be evaluated on only a little bit less, not disappearance totally. Or there may be aggravation. He will say that I came to you with cough, but now it has aggravated more. Or you must find that cough is there, but there is new symptoms. He will say that I did not have headache before, but now I have headache also. So these are the changes you may expect in the follow-up visit after the first prescription. So you'll have to take into consideration all these changes, then you will make the second prescription. Usually our second visit we make after 3 to 4 weeks in a chronic case, and a few days in an acute case. So for example, if a patient comes to you with acute coryza, nasal obstruction, or he may have diarrhea, he may have fever, acute diseases, then you make the follow-up visit after a few days, maybe after 3 days or after 5 days. But if the patient is a chronic one, he has rheumatoid arthritis, joint pains chronically, then after the prescription, you tell him to come after 3 weeks or after 4 weeks. Now, we may see what may be the session, what may be the types of second prescription. Number one, no prescription means no prescription of new remedy, only placebo. It may be like this. You did not give new medicine, only you have given placebo. Or you may give the same medicine as before with higher potency. Or you may need to antidote the first remedy. Maybe it has aggravated so much, or it has brought new symptoms so many that you will have to antidote. Or you may have to give complementary. You gave a medicine before, it acted partially, now you want to complete the cure, so you give complementary. Or you may make first prescription again, that there is no change at all in the symptomatology of the patient, so you make the first prescription again. So types of second prescription may be these 5 ways. Okay, now let us come. If a remedy fails to act, what you will think? Patient came back and he said nothing happened with your medicine. So you may think that was the selection of the remedy wrong? The first thinking that maybe my selection of the remedy was wrong, it was not correct. Second thing, did the patient take the remedy? If not, why? Some patient, some hysteric patient, they will not take the medicine. They want to keep them ill to draw attention of the relatives. So you will have to confirm that the patient has taken the remedy. If the patient is a hysteric one, you will have to tell her guardian to take care so that she will take the remedy. Or you may think that maybe there is some obstacle to cure. That I have given the correct remedy, but the patient has taken some food or some drugs which prevented the action of the remedies. So these 3 things you may think if your remedy did not act at all. Okay, now there is one question that under which circumstances remedy may be changed. I discussed before, that's why I'm not going. Let us come to Kent's 12 observation directly. Dr. J.T. Kent, our most powerful and most brilliant and genius homeopath, what people say after Hahnemann, Dr. J.T. Kent, he has made 12 observations to make the second prescription. So first observation is that you may find in the patient a prolonged aggravation and final decline of the patient. It means, say for example, you gave the patient causticum for a case of knee pain, maybe osteoarthritis of the knee. And after giving causticum, so you have given one name causticum, there is prolonged aggravation, pain, and no relief at all. So then what do you think in the second prescription? If the patient comes with prolonged aggravation and no amelioration at all, what do you think? Let us see. See the left-hand side picture. You see, we gave the medicine here. Say, for example, he had pain, say, up to 10-point pain. After giving the medicine, pain is more 11, 12, 13, 14, maybe up to 20. And pain is going more and more and no amelioration at all. In such case, what you think? You will think that maybe the case was incurable and the maybe was too deep, very high potency. It was an incurable case and you have given too high potency of a medicine. Say, for example, patient might have undiagnosed cancer in the lungs, for example. Undiagnosed cancer in the lungs. And you have given Silesia 10M. So this will just disturb the patient, disturb the complaints of the patient too much, and there will be no amelioration at all. So this is the interpretation. Now, what you will do? He said that in such case, if you think that patient has some deep-seated disease condition, then you don't give medicine higher than 30 or 200 potency. Better, I want to remind you that this 12 observations of Kant is made on centesimal potency. So in such case, you should not have given the medicine more than 30 or 200. So here, in such case, you only decrease the potency and try to palliate the patient. Don't aim at cure. This is an incurable case and you don't try to cure it. You only palliate by giving lower potency. This is the first observation. Now, let us come to second observation. Please, somebody is talking. Please don't talk. Make switch off your sound.
Sir.
Okay, thank you. Second observation is that there is prolonged aggravation like before, but there is final slow amelioration of the patient. You see, there was aggravation and aggravation and aggravation, but at the end, maybe after 3 weeks, there is amelioration. There is amelioration. Patient may say, "Oh, I had too much pain in my knee for the last 3 weeks, but since last few days, I am feeling better." In such case, what you will think and what medicine or prescription you will make? The interpretation is that you got the patient before he became incurable, that patient was going to be incurable, but it did not reach the point of being incurable. It is less than incurable. So you caught him before he became incurable. That's why after prolonged aggravation, there is amelioration. In such case, also, you keep the patient on lower potency. Lower means not 3x or 6C. In centesimal potency, in the view of our homeopathic genius, 30 and 200 are lower potency. More than 10M, higher potency, high potency. 1M is middle potency. It is like this. 30 200 lower potency, 1M middle potency, more than 10M higher potency. So in such case, if you find that there is prolonged aggravation and then amelioration, you don't give higher potency medicine. You give only 30 200 like this. And as the patient becomes better and better, you increase the potency. So this is second observation. Now let us come to third observation of Kant. What is the third observation? There is quick, short and strong aggravation. followed by rapid improvement. You see here, there is short aggravation. You see, this is aggravation because pain was in this level. Now it is more. Then it was going less and less, being ameliorated and ameliorated and ameliorated. So how you interpret such case? You will interpret that this is an ideal reaction. Your medicine was correct, and patient has a good constitution, and there is no structural changes in the vital organs. Say, for example, patient had much cough with expectoration, thick expectoration, and there is dyspnea. You gave him calibachrome. You gave him calibachrome, say 1 ml. So it means that your selection was correct. That's why there is short aggravation followed by long amelioration, and the patient has vital organs not damaged much. If there is much damage of the lungs and you gave calibachrome, there will be much aggravation. So it seems that this case, your selection was correct, and the case was functionally ill. There is no structural damage. So what you will give now? In such case, you don't intervene. You give placebo. If the patient comes after you gave calibachrome, he said, "Sir, I have now less cough, less expectoration, and I have no dyspnea." You gave calibachrome 1 ml, okay. Now you give him only placebo. So this is the third observation. Now let us come to fourth observation. In the fourth observation, there is no aggravation at all of the patient, only recovery of the patient. You see, very ideal. Here you see, there is no initial aggravation. Here you see, there is some little aggravation, then amelioration. Here, only amelioration from beginning. It means your medicine was correct, similimum. Even the potency you gave was similimum to the strength of the disease. That's why there was no aggravation at all, only all amelioration. So your interpretation was remedy was similimum and the potency exactly fitted. So in such case, what you will give? You give nothing also. You give only placebo. This is the fourth observation. Now let us come to fifth observation. There is first amelioration followed by prolonged aggravation. You see, this is very bad. Patient said, after I took your medicine, my cough was better, little better. And then too much cough throughout the month. So let us see the picture. Here you see. After you have given him calibachrome, his cough and dyspnea, everything was better without an aggravation, you see. And then it is worse and worse throughout the month and did not came back to amelioration. So how you will interpret the case? The case is that your remedy was superficial. It was not deep enough. Say you gave him only, say, spongia. Spongia did not touch the case very deeply. That's why there was little amelioration. And also the medicine was partially similar. It was not similimum, partially similar. That's why it did not contain the whole case. That was there was some amelioration and then only aggravation and aggravation. It may be one interpretation. Another interpretation is that maybe medicine was correct. Potency was also correct. But the patient has taken something, some food or some drug, which neutralize the action of your medicine. That's why the complaint was worsening again. You told the patient that after you take homeopathic medicine, don't drink any coffee. Patient was a coffee drinker and he took coffee after few, say after 1 or 2 weeks. That's why the coffee antidoted the action of your medicine and it was worse. That's why you ask the patient that what you did drink or eat after the medicine. The third interpretation was that this patient was incurable. Maybe patient did not take anything bad and your selection was good also, but the patient itself is incurable. Maybe he had cancer in the lungs. That's why your medicine only palliated for some time, but it did not cure the whole case. So for fifth observation, there are, you see, 3 interpretations. Now what you will do, what will be your action? First is you re-examine the case. You re-examine the whole symptomatology. And you find that whether you have given partially similar remedy or the remedy was similimum. Number 1. If you find if it is partially similar, maybe the patient needed, for example, medorinum. Now you see that there are some symptoms which indicate medorinum, or some symptoms which indicate calicharb or calibicrop, deeper remedies. So you give this remedy. Or if there is any obstacle to cure, you ask the patient, don't take this thing or don't take any drinks or food which will prevent the action of our medicine. Okay, so this is the 5th observation and your prescription. Now we come to 6th observation. 6th observation is short amelioration of the symptom only. Let us see. You see, after taking the medicine, there was little aggravation, then amelioration, then no more. After here, there is no more, rather there is little worsening. Here, after short amelioration, there was more and more aggravation. Here, not more and more aggravation, but amelioration was only less. And there is no more amelioration afterwards. Partial amelioration. So, what do you think? You will think that there may be obstacle to cure. Patient may have taken some food or drink, as I said before, which intervened or prevented the action of your medicine. That's why your medicine did not act fully. Here you see, maybe up to here it was good. Then the patient has taken some maybe allopathic medicine, some coffee or some food, which is detrimental to the action of this remedy. That's why there is no more amelioration, rather it is little worse. So what you will do? You remove the obstacle to cure. Ask the patient that don't take this food or drinks, and you may give a constitutional remedy in a different potency. This is the 6th observation. Now let us come to 7th observation. Here, full amelioration of the symptoms, but no relief of the patient. Patient said that I had cough. Now cough is less, but still I am not feeling well. I cannot sleep. My appetite has gone, like this. Patient himself is not better, but his symptoms is better. How you interpret this case? Say for example, here you see, this is the physical symptoms. This graph. This is the physical symptom. His physical symptom is better. Cough is better, but patient himself, his mental emotional symptoms is not better. his appetite is not better, his sleep not better. So what is this? His complaint is better, but patient himself is not better. Now, the interpretation is that this patient is incurable, number one. That's why there was relief of some symptoms, but as a whole, the patient did not have better feeling. So here, remedy only acted as a palliative. Say, for example, a case of lung cancer, and you give him arsenic balm. So arsenic balm removed his dyspnea a little bit, but arsenic balm cannot cure a case of cancer lungs. So what to do in this patient? Here, if it is incurable, if the cancer has reached in incurable stage, Kant will say that don't try to cure the incurable. Here, you only palliate the patient. You give him, okay, you give arsenic balm, maybe you can give spongia, symptomatic relief. You can give Drosera for his cough, like this only. You may give for his cough and chest pain, bryonia, is okay. So you go on only palliating the patient in your second and third prescription. Now let us come to 8th observation. Here patient proves every remedy he gets, especially in higher potency. You see, you give the patient, say here, you give the patient, say causticum for a case of arthritis, okay? After taking causticum, all his symptoms, my God, you see, all his symptoms was worse and worse. Whole month, he had pain, and all the symptoms of causticum. You give the medicine, all the symptoms of the medicine is expressed in the patient. It means all the symptoms of the medicine has been proved on the organism of the patient. So your interpretation is that this is the idiosyncratic patient. It is idiosyncratic patient with oversensitiveness to everything. There are some patients, they are highly sensitive to everything. You will find some patients, they cannot take any food. They said, even if I take water, it becomes gas. There is flatulence. If I take rice, flatulence. If I take bread, flatulence. Meat, flatulence, everything. They cannot tolerate anything. So if you find some patient that you give him arsenic, he develops the symptoms of arsenic. If you give him, say for example, creosote, it develops the symptoms of creosote. So your interpretation is that this is an idiosyncratic patient, hypersensitive allergic patient, possibly has tubercular miasm, can say. So you give him only lower potency. Don't give higher potency, then it will flare up all the symptoms. And if possible, give tuberculinum in intercurrent dose. So this is your 8th observation. I did not find such patient. Sorry. So sorry, there's some disturbance with phone. So in such case, if you find such case, then you will think that this is an idiosyncratic patient with hypersensitiveness to everything. So in such case, you give medicine in lower potency, and if possible, give tuberculinum, as many such patients belong to tubercular myasm. Can say it like this. Okay. Now let us come to 9th observation. 9th observation is the action of remedy over provers. they are not patient actually. The approvers of homeopathic remedies, they develop all the symptoms of the remedy. So this is 9th observation. Let us come to 10th observation. 10th observation is new symptoms appear after the remedy. Let us see. This is the case. You gave him, for example, Neptum salt, okay? Neptum salt for cough. Now you find his complaints remain same. Cough is same. But he developed diarrhea, which was not before. New symptoms has been developed, and all other symptoms as before. So how do you interpret such case? That new symptoms appear after the remedy. It means this is a wrong prescription because it did not cure the symptoms of the patient originally. Rather, it brought a new symptom. So this is a wrong prescription. So what you will do? Because patient will come to you and he will say that I did not have any cure of cough. Rather, now I have diarrhea which was not before with me. So you re-examine the case. You take the symptoms again and find the correct remedy. Now, 11th observation. 11th observation is that all symptoms reappear. Patient said, say for example, patient had some urinary complaint, chronic UTI, chronic urinary tract infection. Always there is pain during urination, there is obstruction of urination, and you will have to get up many times at night to urinate, and you prescribe for him, say for example, acid nitric. Now patient came, oh doctor, yes, my urinary symptom is much better now. But I had a symptom now, which I had long before, that there is pus discharge from my urethra. I had long before contracted venereal disease. I have taken some injections before and it was cured. Now the old symptoms has come back. In such case, you should console the patient that it is not bad, rather you are on the way of cure because our medicine has acted correctly. That's why your old symptom has come back. So what is your action? You just wait and don't intervene. You don't give any new medicines. Only you can give same medicine with higher potency if the action of the previous dose has expired. So this is a good case. Now, another observation, 12th observation, that symptom has taken a wrong direction. We know the Herring's law of cure. Herring's law of cure says that after a correct similimum, after you have given a similimum, the problem of the patient, the symptoms of the patient will go from deeper organ to more superficial organ. If the problem was in the heart, it will come to the joint, not the reverse one, that it was in the joint, now gone to heart, no. But if you find a patient came to you, you have given medicine for his joint pain. Now he came back, doctor, my joint is much better now. There is no pain of joint, but I have distress in my heart. I have palpitation. I cannot sleep. And if you examine his heart by echocardiography, you may find there is some hypertrophy. So then what you think? You have given medicine for pain in the joint. Pain in the joint is relieved, but the heart problem is worse. This is against the direction of cure of hearing. So it means it is a wrong prescription. Though it relieved his joint pain, what you will do? You antidote the remedy and try to select a new suitable remedy. This is the 12th observation. So now we have finished 12 observation, and we will go to Vitulka's 22 observation, and I hope you will understand it better now, because Vitulka's observations have been made on the observations of Kent, and he added some more things only. He improvised it only. So now 22 observations of George Vitulkas. This is our Professor George Vitulkas of Greece. He was born in 1932. So now he is 93 years old. My God. He is now 93 years old. God bless him. Let us come to his 22 observations. You see, he has improvised the observations of Kent. Kent did not separate the symptoms. He only said symptoms is worse, patient better or patient worse. But Vitulkas here, he separated physical symptoms, mental symptoms, and energy. Energy means the patient himself is better or not. So E here, you see, E means energy, means patient himself inside. ME means mental symptoms, emotional symptoms. CC means physical symptoms. So his first observation is that if patient says, I feel much better in every way, that doctor, after you have given me the medicine, I am feeling much better. He had pain all over his body. You have given him rash stops. Especially, I had only little more pain for 1 or 2 days. And since then, I am better and better. What do you think? You see here, after giving the medicine, there was little aggravation for, say, 1 day or 2 days. Then all amelioration. His energy is better, mental symptom better, and particular symptom also better. So your interpretation here is that remedy was precise. You have given a simile imam. A patient has strong defense mechanism. Here what you will give no medicine, just placebo. So this is Vitulka's first observation. Let us come to Vitulka's second observation. You see, it is somewhat like Kent, but with some improvement. Patient will say, I feel very much better. Before he said that I had little aggravation in the beginning, then better. Here he said, Here he said, I had no aggravation. From beginning, I was better and better. So what do you think? You think that your medicine was a good simile imam, correct simile imam. And the potency also was correctly selected. The level of his disease was, say, for example, in a level which suit 200. He has given 200 rash stocks, and there was no aggravation and only amelioration and amelioration. So here also, you don't give any medicine, just you wait and give him placebo. Let us come to his third observation. Here you see, as I told you, Vitulka says, separated the symptoms. You see, this is energy, this is mental symptom, this is physical symptoms. here we find patient says that I feel better. Why he says better? Because his energy is better, his mental symptom better, and particular symptoms are better. But he has some new symptoms, you see. It was not before with him. So patient said, I feel better, but still I have some problems. His major symptoms ameliorated after little aggravation. And while some minor symptoms remain unchanged. A minor symptom remain unchanged. What do you think? Yes, it is still correct remedy. Because after your medicine cannot cover all the symptoms of the patient. Hahnemann in 153 and 54 aphorisms, he said to select a remedy, you try to compare and cover the peculiar symptoms of the patients only. Rare, uncommon, and peculiar symptoms only. There may be many more unpeculiar, common symptoms your medicine may not have covered. So after you give, patient will feel that I am much better, but still there are some symptoms remain because these symptoms was not similar to your medicine. That's why no problem, this will go by itself. So here also you don't give any medicine, just give placebo. Now, observation 4. You see, here also, patient will say, I am feeling better. After 3 weeks, he came back to you. He will say he had, say for example, asthma, difficult respiration. You gave him, say, Kelicar. After Kelicar, he has come to you after 3 weeks or 1 month, and he will say, oh, doctor, I am feeling much better. My asthma is much relieved, but I have few new symptoms. What new symptoms? You will say, now I have backache. I have too much back pain. Now you will have to see this new symptom belongs to your remedy or it is just a new one. So if you find this symptom has belonged to the medicine you have given. So for example, in Kelicar. So Kelicar has back pain. So you will think that this is a false proving of Kelicar. Kelicar ameliorated the patient, the main symptoms, but he has some symptoms which is not similar to the patient, and this symptom has expressed itself to the body of the patient. So this is a new symptom of Kelicar. So in such case, what you will do? You do nothing because the case corrected the complaint of the patient, say 95%. 5% no problem. So you don't give any more medicine, just give placebo. Now let us come to 5th observation. Here patient will say, my main problem is better, but I am still not well. You have given patient Spigelia for his headache. Say the patient had migraine and you have selected Spigelia for him. After taking Spigelia, he came back to you, oh doctor, yes, I have no more headache. Headache is better, but I am not still feeling well. What not well? He will say, I cannot sleep well. I have insomnia, just insomnia. And even I have no appetite. I don't want to take any food. So you see, his particular symptom is better, but his mental and he himself is not better. So in such case, what you will think? You will think that that your medicine has touched only superficial. It touched the patient, it cured the patient on superficial level. So it is not is constitutional or defective medicine, only superficial. So in that case, you will have to give him a better and deeper medicine. Here, sixth observation. Patient said, I am better, but not really well. Here also you see, in CC means particular symptoms. Is particular symptoms better? Definitely better. There is no aggravation even, you see. But mentally and emotionally, he is not better. Also here, you think that it is not a correct remedy. This is only a superficial remedy. And you will have to retake the case and find a better and deeper acting remedy. Okay, seventh observation. You see, there is amelioration of the particular complaint. You see, amelioration. The symptoms is coming down, down means better. His particular symptoms better. But his mental, emotional, not better. Rather, there is new symptoms. So patient will say, my original problem is better. My headache is better, okay. But now I have a new one. The patient will say, I had no vomiting before. Now I feel vomiting, nausea. This is a new symptom added to me. My original symptom is better. The particular symptom is better. The headache is better. But I did not have nausea. Now I have nausea. If I see food, I feel nauseatic. So in such case, what you will think? You will think that this is just suppressive effect of our medicine. It suppressed the headache, but it did not cure the patient. Rather, there is haphazard symptoms came newly to the patient. So in such case, what you will do? Better you try to find a correct remedy. You retake the case and try to cover all the rare, uncommon, peculiar symptoms with a newer remedy, with a better simillimum. If you cannot find, you try to antidote the remedy, because this remedy did not relieve him. Rather, it brought new symptoms. So you antidote it. Then wait for some time to find new symptoms of the patient and try to select another remedy. So antidote, then select another remedy. Okay. Observation 8. Again, patient will say that my original symptom, you see particular symptom, little better. But I have more symptoms, new symptoms. I have more symptoms, new symptoms added to my disease picture. So in such case also, you think that this medicine has brought some newer symptoms. It has brought some newer symptoms to the patient. So in such case, you cannot continue this medicine because it has brought newer symptoms. And original symptom only little better. So in such case, you find a newer remedy to cover all the picture. Ninth observation, you see, patient will say, I was much better, you see, but now I am worse again. After initial response, he felt much amelioration, then again worse. All the mental symptoms and particular symptoms. So what do you think? You will think that patient became that this was the correct remedy rather. you should wait, because you see, though it was little bit worse, but still it is better than the beginning of his symptoms. You see the level of his beginning of the symptom. So it was evaluated a little worse now. So maybe he has taken some wrong food or something. It disrupted the action of the medicine. But if you wait, it will be better again. Because though it was little worse, but still it is better than his original level of the symptoms. So in such case, you just wait and don't give any new remedy. Now, observation 10. Also, similarly, that there was initial amelioration, but then symptom was worse. Then the symptom was worse. So what will you do in this case? So you may think that there may be some intervention, some prevention of its action by some food or something, which antidoted the action of the remedy. So in such case, you take the case again, and if you find that same remedy picture remain, you give a higher potency, because this medicine acted well. Only lately there was some worse again. It means the same remedy, if you give in higher potency, it will cure the patient, because this is the way of symptoms only. If you give a patient, say for example, Rastos for his pain, Rastos 30, so it will act for say 2 weeks. The patient will say, I was better for 2 weeks, but now I'm getting worse again. So you give Rastos 200. So here also it is like this. That he was much better, then there was a worsening again. So you retake the case. If you find the same remedy indicated, give a higher potency. Here also almost same. You see, Bitolkas made 22 observations, Cat only 12 observations, but Bitolkas observations are not much different from one another. You see, these are very nearby. So here also patient will say that I was better, but now worse again. You see, I was better, but now worse again. So you may think that the medicine was acting only partially. Medicine was acting only partially. It was not a good simillimum, number one. Or the case was incurable. This medicine only acted partially because the case was incurable. Either your remedy was incorrect partially, or the case was incurable. In such case, what you will do? Just you will have to retake the case and find a new remedy on present conditions of the patient. Just new remedy, not the same medicine again. Same medicine again if the symptoms here. But you see, the symptoms are worse. So you will have to find a new remedy in such case. Here also you see, the medicine, it seems, acted partially. It acted for some time. If it is 1 month, you see, this is 1 month. Here you give them a patient, and after 1 month. So only 1 week he was better, only 1 week. After 1 week, he was worsening again and again, you see. So here you may think that this is an incurable case, because the medicine acted here, but it could not correct the whole case. It means the disease was very deeper case, or more tough case, incurable case, and the medicine could not correct the whole problem. So what you will do? You just give a new remedy, because this remedy is not appropriate to the whole case. So you retake the case and give a new remedy, not the same remedy again. No. Here patient will say, I am same. I have no change either in particular symptom or mental symptom or energy. So here you retake the case, and give another appropriate remedy. Your medicine did not act here well. So you give a newer remedy. Here also almost same, but little better. Patient will say, my symptoms did not change. You see his particular symptom same, but his mental symptom little bit better. So because there is little bit better of mental symptom, you may wait for some time to see how the symptom goes. Then you decide whether you will give new remedy or not. It is almost same. Here also, you will have to wait to see if there is more change. Here you see, he has some minor symptoms added, and all other symptoms remain same. So you may wait for some time whether there is better picture on which you can give a new remedy. That's why just wait. Patient said that I did not have headache before, now I have headache. You give him some placebo, say okay, just wait for 1 week, then report me again. It is almost same, you see. Here also you retake the case and give another remedy because there is no much change in the case. So it means your first remedy was not correct. You retake and give new remedy. Here the patient will say that all my symptoms was worse almost throughout the month. You see, 1 month. So here maybe 3 weeks. He said, after I have taken your medicine, 3 weeks I was worse. You gave me Posticam for his arthritis. And after giving Posticam 1M, 3 weeks he suffered with more joint pain. But since last week you say, I am getting better. So here you think that your medicine was correct. And you don't give new medicine. Just wait, give him placebo. Here, patient will say that there is all aggravation. Throughout the month, he had problem worse and worse. And he did not have any amelioration, any benefit from your prescription. So what you do, it means it was not appropriate to the case. So you retake the case and give a new remedy to this case. Here it is also like before, like this one, but there is some difference. Here there is all aggravation, no amelioration. But here we find there is aggravation, but lately there was amelioration. So here you don't change the remedy. There was aggravation, but lately there was amelioration. So here you may think that this is a deeper case, a little bit tougher case, and your medicine, maybe it was inappropriate to act, but it acted at the end. It means it is curable case, and medicine was similimum. So just wait and repeat the medicine with higher potency. Here, 20th observation. Patient will say, oh my God, after your medicine, whole month I was worse. Whole month I was worse. But you see, still, mentally he was better. His energy was not worse. Mentally he was better. So you may think that his particular symptom is worse. Maybe your potency was higher. So here you just wait and give more time to the medicine. Maybe this will come down. It will be ameliorated afterwards. So if the patient says, I am mentally, it's okay. I have better sleep. I can take food well, but only my headache is worse. So you give him placebo, tell him just wait another 1 week or 10 days, then come to me back. So this is 21 observation. Also, same thing. Here also, little bit different. He is mentally, he's much better than this case. You see, here mental was not much better, but here mentally, emotionally, he is much better. Only his physical symptoms did not improve, but it has tendency to come down. You see, it has tendency to come down. That's why you don't change the remedy. You just give the medicine little more time. You told him, the patient, to come after 3 weeks. Okay, now give him placebo. Tell him come after another 2 weeks. And if you find these symptoms ameliorated at the end, then don't change the medicine. Give the same medicine with higher potency. The last one, 22 observation, also almost same. Almost same. Here, no, it is not same. It is different. Here you see, his particular symptoms much better, but mental symptoms aggravated. You see, it was, the last case was mental was better, but particular was worse. Here, the particular better. He came to you for headache is better, but mentally he's a little bit irritated. His sleep is not good. He becomes angry and irritable, something like this. So you will have to think that this mental worsening has tendency to come down. He said, yes, I was worse in the beginning, but now a little bit, I'm sleeping a little bit better than before. So in that case also, because all his particular symptoms and his energy is better, don't change the remedy. Though his mental symptom is irritable, you just wait for some time more. And if you find that at the end, his mental symptoms also became calm down and better, then you don't change the remedy, give the same remedy with higher potency. Okay? So, thank you very much, Dr. Anwar Parwari. I am giving the microphone back to you. If there is some, and this is nice that we have finished this long lecture of case taking and selection of symptoms and evaluation of symptoms, then second prescription, follow-up. It's a long lecture, really. So, Alhamdulillah, I am happy that we have, at the end, we have finished this long lecture, and it is really very important for a homeopathic doctor to know how to take the case. We have discussed very well how to take the case. Then after taking the case, how to select the important symptom to select your medicine. Because you should not take all the symptoms to select your remedy. You will have to take only rare peculiar symptom to select the remedy. So second phase is selection of symptoms. Third is selection of your remedy. How to select the remedy? You may take the help of repertory, or you may take the help of your knowledge of past materia medica. Then comes, after selection of medicine, what potency you will give. If for 50 millisiemen potency user, this is very easy. You have to give everything, all medicine, in child or in old patient, in acute or chronic patient, in mental or non-mental patient, everyone from M1 or M2. So this is good. But in centesimal potency users, there is a rule how to select potency. We discussed it. So after giving your patient your similimum, then the question of follow-up comes. How to make follow-up? For follow-up, you will have to know handstand of the 12 observation and video class 22 observation. To know how to prescribe the second remedy in the second prescription. So this is actually very core knowledge of a homeopath you will have to acquire. So thanks God, we have covered the whole things. I hope if I find time, next time I'll give the lecture in Bengali, little bit in brief way, so that other people, they can also understand and can learn this important chapter of homeopathy, and they can use it in their day-to-day practice. Okay, Dr. Anwar Patwari, if there is some question or commentary you can take, still we have some time. Assalamu alaikum. You can ask question in Bengali. We can talk in Bengali, no problem. If somebody thinks so. Dr. Patwari, your sound is not clear. Sound is little bit unclear.
Thank you very much, sir,
Yeah.
for your excellent presentation. Anybody have any question? Please raise your hand. I will declare your name. আপনারা চাইলে বাংলায়ও প্রশ্ন করতে পারেন। আমরা বাংলায় বা ইংরেজি যে কোনো ভাষায় আপনি প্রশ্ন বা মন্তব্য করতে পারেন। হ্যান্ড রাইজ করলে আমরা নাম ঘোষণা করব।
Iqbal Majid, Dr. Iqbal Majid.
Yeah, thank you very much, sir, for your excellent presentation on observation, Dr. Kent and Dr. Vitulkas. Now, I have many questions from your observation. One important question is that how can we cope with this observation like 15 to 19, almost same? And second is, when we are prescribing second prescription, what indication can we make? How? Make clear, sir.
I don't understand your question.
Okay.
Not clear. No, your sound is not clear. Okay, tell me again. Okay.
আমি বলছিলাম স্যার যে এই যে অবজারভেশন গুলো বেশ কিছু অবজারভেশন আছে অলমোস্ট সেম ফ্রম ভিতলকাস। আমরা একজন প্র্যাকটিশনার হিসেবে আমরা কেমন করে ইন্ডিকেটর সেট করব, কারণ আমরা তো প্রতিনিয়ত রোগী দেখি। যখন রোগী আমাদের কাছে আসে তখন দেখা যায় পেশেন্ট অ্যালোপ্যাথিক ঔষধ ইনটেক করতেছে, হোমিওপ্যাথি নিচ্ছে, সাথে অন্য মেডিসিন নিচ্ছে। যখন অবজারভেশন গুলো হবে, অবজারভেশন আলোকে মানে আপনি রিপিটেডলি স্যার একটা ইনকের এবং ইন অর ব্যবহার হয়েছে স্যার অবজারভেশনের মধ্যে। তো আমরা কিভাবে একজন হোমিওপ্যাথি হিসেবে সেকেন্ড প্রেসক্রিপশনে এইগুলাকে কোপ করব? থ্যাংক ইউ স্যার।
ওকে, আপনার যেটা বলছি, আমি তো বললাম যে ভিতরকাসের গুলা আর একটু ফাইনার ইন্টারপ্রিটেশন। আপনি ভিতরকাসেরটা যদি কনফিউজ করেন, কারণ ভিতরকাসের কিছু আছে অলমোস্ট সেম, কিন্তু মানে কিছু ফাইনার ডিফারেন্স আছে। আপনি যদি আলাদাভাবে দেখেন, আমি এখানে বেশি আনি নাই কারণ অনেকে কনফিউজ করবে, কিন্তু যদি আপনি আলাদাভাবে দেখেন দেখবেন ফাইনার ডিফারেন্স আছে। কিন্তু এমনি দেন নাই, আপনার কাছে মনে হবে যে অলমোস্ট সেম ঠিক আছে, বাট নট সেম। এই জন্য আপনি বেটার ক্যান্টেটটা ফলো করবেন। ক্যান্টেটটা ক্লিয়ার, ক্যান্টেটটা একদম আলাদা।
কিন্তু অবশ্য এখানে বলছেন যে যেমন আমরা যারা ইউজার সেন্টিসিমেল এট দ্য সেম টাইম উই আর ইউজার 50 মিলিসিমেল, তো এখানে যদি আমি 01 02 তো অল এজ গ্রুপে সেম মেডিসিন দেই, তাহলে এই অবজারভেশনের মধ্যে ডিফারেন্সটা কি হবে?
আচ্ছা বলছি আপনাকে, দেখেন এখানকার যে অবজারভেশন আমি আগেই বলছি, কিন্তু এটা হলো অন সেন্টেসিমাল পোটেন্সি এর উপর ভিত্তি করে এটা হয়েছে। কিন্তু কেন তো আর 50 মিলিসিমেল ব্যবহার করেন নাই, উনি সেন্টেসিমাল ব্যবহার করতেন। এটা সেন্টেসিমালের উপর 50 মিলিসিমেল হলে এটা সবটা খাটবে না, এখানে কিছু চেঞ্জ হয়ে যাবে। এটা আরেক কিছু, এটা এখানে আমরা আরো 50 মিলিসিমেলের জন্য আরো কিছু পয়েন্ট এখানে যোগ হবে। এখানে যা বলা হয়েছে এটা কিন্তু সেন্টেসিমাল পোটেন্সির উপর ভিত্তি করে। মেক ইট ক্লিয়ার।
ইয়েস আই এম ক্লিয়ার, বাট কোয়েশ্চন ইজ যখন স্যার খুব ক্রনিক অবস্থা নিয়ে আসে, আমি যখন সেকেন্ড প্রেসক্রিপশন করতে যাই, তখন তো তার মধ্যে যে ঔষধজনিত কারণে যে অ্যাগ্রেভেশন আপনি দেখাইলেন স্যার এই গ্রাফের মধ্যে, তখন স্যার আমি আবার কেমন করে কোন ইন্ডিকেটরে তাকে কি প্লাসিবো দেব নাকি নিম্ন শক্তি দেব নাকি উচ্চ শক্তি দেব, এইটা তো ক্লিয়ার না স্যার।
এটা তো আপনি রুগীর অবজার্ভ করে বুঝতে হবে, রুগীকে জিজ্ঞেস করতে হবে। আপনি যখন বুঝলেন একটা কেস যে এটা তো আমি দিলাম, প্রথম 2 সপ্তাহ ভালো কাজ করলো, পরের সপ্তাহ থেকে কাজ করলো না কেন, এখানে তো দেওয়া আছে তো ইন্টারপ্রিটেশন গুলা। আপনি রুগীকে জিজ্ঞেস করবেন যে আপনি যে ওষুধটা খেয়েছেন এর মধ্যে কি আর কোনো ওষুধ ব্যবহার করেছেন, আপনার খাওয়া দাওয়া কি ছিল, আপনি কফি খেয়েছেন, বা এমন কোনো খাবার খেয়েছেন যেটা আপনার ওষুধকে ডিস্টার্ব করে, আপনি জিজ্ঞেস করবেন। বা তাকে তাও জিজ্ঞেস করবেন কোন এলোপ্যাথিক ওষুধ খেয়েছেন। সে হয়তো বলতে পারে হ্যাঁ, যে আমি যখন দেখলাম যে আপনার ব্যথায় যেভাবে আমার পাওয়ার কথা, ব্যথাটার উপশম আমি পাচ্ছিলাম না, আমি আগের ওষুধও খেয়েছি। কি বলবে আপনাকে।
থ্যাংক ইউ স্যার, থ্যাংক ইউ ভেরি মাচ।
আপনাকে নিতে হবে জিজ্ঞেস করে। ওকে, থ্যাংক ইউ।
ধন্যবাদ। আর কারো কোনো প্রশ্ন বা মন্তব্য থাকলে হ্যান্ড রেজ করলে আমরা নাম ঘোষণা করব। কারো কোনো প্রশ্ন বা মন্তব্য আছে কি? আমরা কারো হ্যান্ড রেজ দেখতে পাচ্ছি না। যদি কারো কোনো প্রশ্ন বা মন্তব্য থাকে, হ্যাঁ,
রাজিয়া সুলতানা, হাফসা,
আপনার মাইকটা আনমিউট করে প্রশ্ন বা মন্তব্য করবেন। আপনার মাইকটি আনমিউট করবেন প্লিজ।
আসসালামু আলাইকুম স্যার। আমি আসলে জানতে চাচ্ছিলাম যে ভিতুল গাছ স্যারের এই যে 22 অবজারভেশনটা কি লিখিত আকারে পেতে পারি কিনা একটু।
হ্যাঁ পেতে পারেন, আমাদের এখান থেকে কপি করতে পারেন।
আচ্ছা, এটা একটু
এটা লিখিত আকারেও আছে, পেতে পারেন।
আচ্ছা হ্যাঁ, একটু লিখিত আকারে অথবা প্রেজেন্টেশনের ছবিগুলো যদি আমরা একটু পেতে
ছবি নিতে পারেন, এখানে পুরাটাই দেওয়া আছে ব্যাখ্যা টেকা সহ।
আচ্ছা, এটা তো এখান থেকে তো পাওয়া যাবে, এটা কিভাবে পাবো? এটা কি ওই যে ফেসবুক গ্রুপে পাওয়া যাবে?
এই ক্লাসটি আমাদের বাংলাদেশ হোমিওপ্যাথি পরিষদের ফেসবুক পেজে আপনি গেলে এই আজকের টোটাল ক্লাসটা, এই প্রেজেন্টেশনটা আপনি ওখানে পেয়ে যাবেন। ওখান থেকে আপনি রিপিটেডলি শুনতে পারবেন এবং আপনি শেয়ার দিয়ে আপনার টাইম লাইনেও রেখে দিতে পারবেন।
আচ্ছা, পেজের নামটা স্যার আরেকবার।
বাংলাদেশ হোমিওপ্যাথিক পরিষদ, বাংলা অথবা ইংরেজিতে আপনি সার্চ করলেই বাংলা এবং ইংরেজি দুই ভাষাতেই একই টাইটেলে আছে, আপনি পেয়ে যাবেন বাংলাদেশ হোমিওপ্যাথিক পরিষদ।
গবেষণা পরিষদ এটা?
না, হোমিওপ্যাথিক পরিষদ, গবেষণা পরিষদ নয়, বাংলাদেশ হোমিওপ্যাথিক পরিষদ। আমি লিঙ্কটি আমাদের কমেন্ট বক্সে দিয়ে দিচ্ছি। জি, ধন্যবাদ আপনাকে। আর কারো কোনো প্রশ্ন বা মন্তব্য আছে কিনা প্লিজ?
ধন্যবাদ স্যার।
হ্যাঁ,
আর কারো কোনো প্রশ্ন বা মন্তব্য যদি না থাকে, স্যার আর কোনো মেসেজ যদি আমাদের জন্য?
একটা মেসেজ দিচ্ছি আমি। সামনের সপ্তাহে আমি ঢাকায় থাকছি না। আমি আমার মাসের 5 দিন আমার গ্রামে গিয়ে আমি ওইখানে রুগীদের সেবা দেই। তো এই জন্য সামনের বুধবারে ক্লাসটা হবে না, এরপরের বুধবারে ক্লাসটা হবে। আমি আপনাদেরকে নোটিফাই করবো এর আগেই। তো সামনের বুধবারে আমার ক্লাসটা হচ্ছে না। ওকে, থ্যাংক ইউ।
ধন্যবাদ স্যার, আপনাকে অসংখ্য ধন্যবাদ জানাচ্ছি। অনেক লম্বা সময় নিয়ে অনেক পরিশ্রম করে আমাদেরকে প্রেজেন্টেশন দেওয়ার জন্য। এছাড়াও যারা ক্লাসের শুরু থেকে শেষ পর্যন্ত উপস্থিত ছিলেন সবাইকে আন্তরিক ধন্যবাদ জানাচ্ছি, এবং পরবর্তী ক্লাসের ঘোষণা আমরা নিশ্চয়ই আমাদের ফেসবুক পেজে এবং আমাদের স্যার তার নিজের ফেসবুক প্রোফাইলে আপলোড দিয়ে দেবেন। নিশ্চয়ই সেটাকে ফলো করে আপনারা আমাদের সাথে থাকবেন। আন্তরিক ধন্যবাদ। স্যারের জন্য দীর্ঘায়ু কামনা করছি, সুস্থ হায়াত কামনা করছি আল্লাহ রাব্বুল আলামিনের দরবারে, এবং আমরা যেন আত্মমানবতার সেবায় নিজেদেরকে নিবেদিত রাখতে পারি এবং হোমিওপ্যাথিকে বাংলাদেশের চিকিৎসা ক্ষেত্রে অগ্রগণ্য করে রাখতে পারি। সেই তৌফিক যেন আল্লাহ রাব্বুল আলামিন আমাদেরকে দান করেন, সেই জ্ঞানে যেন আমাদেরকে সমৃদ্ধ করেন, এই দোয়া কামনায় আজকের মতো বিদায় নিচ্ছি। আল্লাহ হাফেজ। আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু।
আসসালামু আলাইকুম।